So, the next speaker is straight out of Ireland, and he's Eamonn Delahunt. He's a senior lecturer in Ireland, and trained as a physio, and has done a lot of research also in groin pain. And thank you for coming, Eamonn. It's a pleasure having you here. Thank you very much.
Okay, I'd firstly like to thank the organising committee for the generous invitation to come and present some of my data today. So I'll get straight into it. When considering the role of the adductor musculature in the etiology of athletic groin pain, and in particular in adductor-related groin pain, there are a number of issues that warrant consideration. Firstly, it is necessary to consider whether decreased adductor strength is a primary or intrinsic risk factor for adductor-related groin pain. If indeed this is the case, then it is necessary for clinicians to be able to assess and quantify adductor strength in a reliable manner and whereby they have an appreciation of the mechanics of the assessment. Furthermore, in order for the assessment to have clinical utility, it should have discriminative capacity as well as predictive capacity. So there is emerging evidence to support the hypothesis that decreased adductor strength is a primary or intrinsic risk factor for adductor-related groin pain. Consequently, the assessment and quantification of adductor strength should be of primary clinical importance to clinicians. So various methodologies related to the assessment and quantification of adductor strength have been eloquently articulated in this YouTube video, with many of the methodologies being based upon the previous work by Professor Thorberg and colleagues. However, one assessment that does not feature in that YouTube video is the adductor squeeze test. And in my opinion, the adductor squeeze test satisfies a number of key criteria related to the assessment and quantification of adductor strength. It is a reliable measure. It is cheap and easy to conduct. It only requires a single operator. It has established discriminative capacity. And later on, I'm going to present some new data relating to the predictive capacity of preseason adductor squeeze test scores. So with respect to the mechanics of the adductor squeeze test, previous research at my laboratory has shown that the highest squeeze values, as well as the highest adductor longus muscle activation, occurs in the 45-degree hip flexion test position. So we recommend the utilization of this test position for the pre-season and in-season screening of athletes. Furthermore, we know that the 45-degree hip flexion test position exhibits excellent intra-rater reliability, and we've also established a minimum detectable change value for this specific hip flexion test position. A study published in the Journal of Science and Medicine and Sport by our group again has shown that the adductor squeeze test has discriminative capacity. So what we see here is that Gaelic football players with long-standing adductor-related groin pain have decreased squeeze test scores when compared to their non-injured counterparts. This difference is statistically significant and a very large associated effect size. So I'd now like to present some new data relating to the capacity of pre-season adductor squeeze test scores to predict athletes at risk of developing adductor-related groin pain. So everybody is aware of the Van Mechelen sequence of injury prevention model, whereby knowledge of the epidemiology of injuries pertinent to a particular sport, as well as the risk factors for the development of those injuries are of primary clinical importance. So I undertake some research related to Gaelic football. And when we look at the epidemiology of injuries in Gaelic football, we will see that pelvis and groin injuries are a top 5 injury in this particular sport. And they represent around 9.4% of all injuries incurred in this particular sport. So if anybody isn't familiar with Gaelic football, hopefully this video might give you an indication of the physical fitness demands of the players, which replicate those of Australian rules football and are quite similar to rugby union and soccer to a lesser extent.
Cullen couldn't hang on. Michael Darragh Macaulay fires the ball forward to Bernard Brogan. Brian Cullen. Kieran Kilkenny. Bottled up 3 Cork men close to him. Bernard Brogan just the same. Cian O'Sullivan spots a gap and pumps the ball into the space. Mannion's out there and Jack McCaffrey going round the back. McCaffrey is through! Oh! What a goal from Jack McCaffrey!
So I also included that because Jack McCaffrey, who just scored the goal, is a medical student at UCD as well. So that was the other motivation for including that. So this is a schematic of my study. It's currently under review. So all Gaelic players of a senior elite intercounty football team participated in a pre-season musculoskeletal injury screening evaluation. And the specific components of the pre-season screening related to athletic groin pain were the Hagos Sport and Recreation subscale and the Adductor squeeze test. So all players were followed prospectively from January 2014 up until August 2014, until the team was knocked out of competition. And players were followed prospectively on a weekly basis. Injury incidence was logged, as well as match exposure and training exposure. So over the course of the season, 10 athletes developed adductor-related groin pain, and 45 didn't. So this data presents the pre-season adductor squeeze test scores for those athletes who developed adductor-related groin pain and those who didn't. And what I'm presenting here is the group mean values plus the 95% confidence intervals. So with this data, we developed a receiver-operator characteristic curve. And the prediction capacity of the model was statistically significant with a C statistic of 0.76. And the resultant prediction equation yielded a sensitivity of 0.7 and a specificity of 0.78, indicating that an adductor squeeze test score below 225 predicted adductor-related groin pain. So, relative to our pre-season Hagos scores, we can see that there's a substantial difference between those who did and did not develop adductor-related groin pain. So again, I'm presenting the mean values plus the associated 95% confidence intervals. So again, with this data, we developed a receiver-operator characteristic curve. The model had statistically significant predictive capacity with a C statistic of 0.75. And the resultant prediction equation yielded a sensitivity of 0.7 and a specificity of 0.73, indicating that a Hagos Sport and Recreation preseason score below 87.5 predicted adductor-related groin pain. So I now want to change topic a little bit because I've been asked to speak about adductor squeeze test and hip joint range of motion. The other area of research that related to sports that I conduct is related to elite rugby union. And when we look at the epidemiology of the injuries in elite rugby union, we will see that adductor muscle injuries are a top 10 injury. They have an incidence of 2.5 per 1,000 player hours. So previously published literature has shown that players with long-standing athletic groin pain have decreased hip joint range of motion when compared to their non-injured counterparts. So consequently, the assessment and quantification of hip joint range of motion should be of primary importance to clinicians. So again, when we have a look at the literature, various methodologies for the assessment and quantification of hip joint range of motion are presented. However, one of the limitations of these methodologies are that they're very time-consuming for busy clinicians working with elite athlete squads. So in respect of this, we've undertaken some work in conjunction with Leinster Rugby and developed what we call the HipStar, so the hip screening tool for the assessment of rotation. So it allows the quantification of internal and external rotation in a weight-bearing position. So to date, we've primarily concentrated on establishing the reliability of this device. And I can confirm that we have excellent intra-rater reliability for an experienced therapist undertaking the assessment, for a novice therapist undertaking the assessment, and for players undertaking self-assessment of hip joint range of motion. So this table here presents the inter-rater reliability of an experienced physiotherapist compared to the players. And we have right hip internal rotation, right hip external rotation, and the same for the left. And the most valuable outcome of this slide is that we're very confident that player self-assessment of hip joint range of motion on a weekly basis is a reliable measure. Now, this has got clinical consequences because it can free up time for busy clinicians to undertake other aspects of assessment, diagnosis, and treatment. So where we're at in relation to the HipStar at the moment is we're currently conducting studies to establish its discriminative capacity as well as its predictive capacity. So in order to finish off, my take-home message kind of relates to a podcast that I was recently listening to in BJSM related to the preseason screening of athletes. So if any clinicians are involved in the preseason and in-season screening of athletes, whereby they're involved in sports with a high incidence and prevalence of groin pain, I would encourage them to consider utilizing the Hagos Sport and Recreation Subscale Score, as well as the Adductor Squeeze Test, and to perhaps think about these two values as threshold values for the potential identification of athletes at risk of developing athletic groin pain. So, thank you for your attention.